Hi, my name is Jennifer LeBranch, and I'm doing a project on the Canadian healthcare system as part of my undergraduate summer studentship with the Faculty of Medicine and Dentistry. This slide just shows an overview of what I'm going to be discussing today.
The role of the government in healthcare is divided between federal and provincial government, according to the Canadian Constitution. The roles of the federal government include to set policies, like the Canada Health Act, offer financial support to the provinces and territories, and provide services to groups of people under its jurisdiction. Groups of people under its jurisdiction include First Nations people living on reserves, the Inuit, people serving in the Canadian Forces, veterans, inmates in federal prisons, and some groups of refugees. The roles of the provincial or territorial governments include to deliver most healthcare services and determine which services are considered medically necessary services and thus will be funded by that province or territory. The Canada Health Act was passed in April 1984 and later updated in 1996. The main principles of the Canada Health Act include public administration, which means that provincial healthcare insurance plans must be non-for-profit and administered by a public authority that is accountable to the provincial or territorial government. Secondly, it must be comprehensive, meaning that plans must ensure all services deemed medically necessary, which is determined by that province or territory. Third, it must be universal, meaning that they must provide insured services to everyone, everywhere. Fourth, it must be portable, meaning that provinces must provide insured health services to its citizens while they are temporarily out of either that province or the country. And last, it must be accessible, meaning that they must provide insured individuals with reasonable care without any discrimination. The Canada Health Act applies to any person lawfully entitled to be or to remain in Canada who makes his home and is ordinarily present in the province, but does not include a tourist, a transient, or a visitor to the province.
This slide shows where some of the Canadian healthcare dollars are being spent. As of 2013, 30% of healthcare spending was going towards hospitals, 16% towards drugs, and 15% towards physicians. This slide shows what the projected values were for budget spending on healthcare between provinces. You can see that the northern areas have more money per person spent on healthcare than the other areas of the country.
Canada has a mixed public and private system, meaning that it has funding coming from several places. The provincial government supplies 65% of healthcare funding, and the provincial government is also funded by the federal government. Out-of-pocket payments account for 14.7% of healthcare funding, and private health insurance accounts for 12%. Healthcare can either be funded publicly through Canadian Medicare or privately through out-of-pocket payments or through private insurance plans, which are paid for by the employer and/or the individual. Government-funded supplementary benefits are also provided to certain groups that are eligible for coverage of healthcare services that are not normally funded through Medicare. Groups such as seniors, children, and low-income residents may be eligible to receive health benefits for prescription drugs, dental care, vision care, and medical equipment. In addition to supplementary services being available to residents through demographic-specific insurance plans, like the Seniors Alberta Blue Cross plan, there may be additional government programs in place such as AISH in Alberta. AISH stands for Assured Income for the Severely Handicapped, and it provides benefits for prescription drugs, essential diabetic supplies, optical benefits, dental benefits, and emergency ambulance services for Alberta residents that are severely handicapped and whose income falls under the limits set by age.
Primary healthcare is the first point of contact for healthcare services. The services include treatment and prevention of common diseases or injuries, basic emergency services, health promotion, palliative care, rehabilitation services, and maternity care. They also provide referrals to other health professionals and services. Secondary care is specialized care in hospitals, long-term care facilities, or in the community, but they're all upon referral. Tertiary care is care provided by extremely specialized individuals, like neurosurgeons. Quaternary care is the most complex level of care and is only available at very select centers. Around the world, healthcare systems are evolving to allow for more effective coordination of primary care. In Canada, this is done through primary healthcare networks. Specifically, in Alberta, they are referred to as primary care networks, and in Ontario, they are referred to as local health integration networks. Geographic specific networks are important for quality care because different locations have different health needs. Alberta specifically set out goals for its PCNs as being to improve patient access, provide round-the-clock primary care services, increase emphasis on health promotion, disease and injury prevention, care of patients with chronic diseases and medically complex problems, coordinate care, foster team approaches to primary health care delivery. And all of these, although they were set out for Alberta, would be similar for all healthcare networks in Canada. This image shows how Canada ranks compared to the rest of the world in healthcare spending. As of 2011, Canada was spending 11.2% of its GDP on healthcare, placing it in the top 5 countries in the world for healthcare expenditure in proportion to GDP.
This graph shows Canada compared to the rest of the world in terms of quality of care. It compares Canada with OECD member countries, which include countries such as Australia, France, Germany, Ireland, Sweden, the UK, and the United States, along with many other countries. When the dots fall above the line, it means that Canada is ahead of the average OECD country in terms of quality of care. However, when the dot falls below the line, it means that Canada is falling behind the other countries.
In summary, we looked at the division of healthcare roles between federal and provincial governments, the Canada Health Act, financing, delivery of healthcare services, primary healthcare networks, and how Canada compares to the rest of the world.